Here we go. Question number 6. Marco falls off his bicycle and injures his ankle. Which of the following actions should the initial response to the injury in the extrinsic pathway? All right. Is it the release of calcium, release of tissue thromboplastin? Is it the conversion of factor, 11 to factor 11A? Or is it a conversion of factor 8 to factor 8A? What are we thinking? You know what I'm saying? But anyway, the answer is B, the release of tissue thromboplastin, right? Tissue thromboplastin is released when damaged tissue comes in contact with clotting factors. That is physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. 100% on the NCLEX is crazy. All right, question number 7. Instructions for a client with lupus would include information about which of the following blood dyscrasias. Is it Dressler syndrome? Is it polycythemia, essential thrombocytopenia, or von Willebrand's disease? ATI is horrible. I bet it is. And the answer is C. It's essential thrombocytopenia. Essential thrombocytopenia is linked to immunologic disorders such as lupus and HIV. All right. Question number 8. The nurse is aware that the following symptom is most commonly an early indication of stage 1 Hodgkin's disease. Is it pericarditis, night sweats, splenomegaly, or persistent hypothermia? What are we thinking? Here we go. And the answer is B, night sweats. And stage 1 symptoms include a single enlarged lymph node, usually unexplained fever, night sweats, malaise, and generalized pruritus, right? So that is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam, 4th largest section. All right. So make sure. Here we go. Question number 9. Francis with leukemia has neutropenia. Which of the following functions must be frequently assessed? All right. So is it blood pressure, bowel sounds, heart sounds, or breath sounds? All right. And remember, on NCLEX, it's all about critical thinking. You have to be able to critically think in order to make a clinical judgment. And the answer is D. It is breath sounds. Pneumonia, both viral and fungal, is a common cause of death in clients with neutropenia. So frequent assessment of respiratory rate and breath sounds is required. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam, making it the 4th largest section on the NCLEX exam. It's kind of funny because I see a lot of people ask or say A, and it was definitely D. So I guess these questions aren't all that damn easy, huh? Y'all are funny. Here we go. On to the next one. Here we go. Question number 10. The nurse knows that neurologic complications of multiple myeloma usually involves which of the following body systems? All right. Is it brain, muscle spasms, renal dysfunction, or myocardial irritability? What are we thinking? And the answer is B. It is muscle spasm. Back pain or paresthesia in the lower extremities may indicate impending spinal cord compression from a spinal tumor. This should be recognized and treated promptly, as the progression of the tumor may result in paraplegia. Right? That is part of physiological adaptation, which is the 3rd largest section on the NCLEX at 11 to 17%. Remember, when you guys are reading your effing question, make sure when you're reading your question, read your effing answers. And then when you get it right or wrong, because you won't get them all right, read your effing rationale, RTFR. All right? Stop playing games with me. All right? Stop playing games with me. Get this learn on. You know what I'm saying? Get into a routine. Shout out to everybody that got that right.